Okay, guys, today is week 4 of our onboarding session. At this point, the majority of y'all should have already completed your launch party, or it should be coming up in the next week or so. We do have a couple of other people that are joining us from Virginia and Louisiana, so welcome. And I know y'all have kind of caught up and gone over the last 3 calls. So you're kind of coming in almost halfway through. So this will be halfway through. Of our onboarding calls. And again, the purpose of these is really so I can kind of reiterate what we went over in training, but also kind of give you some information as far as some marketing advice. And then also we go over some AR questions and some kind of basic injecting things as well. So today we're going to talk about how to do an eyebrow lift, and we're going to go over microneedling. And then for our AR review, we're going to talk about employee discounts and touch-ups. And then we have our marketing homework for the week. If you have any questions, please feel free to unmute yourself, or you can also go into the chat. So we're going to talk about, we're going to watch a quick video over what is...
Have you ever considered at-home
an eyebrow lift? Here we go. It's an eyebrow lift, so it's about a 10-minute video. This is from Dr. Tim Pierce. He's a great educator. He does a lot of things on Instagram and TikTok. And so he was actually one of the ones that I had told y'all that I think y'all should follow as well on Instagram, because you need to kind of be a sponge when you enter into the aesthetic world, and you need to try to learn anything and everything that you can get your hands on, especially if it's going to be free training. He is awesome. I really like a lot of the things that he does. So someone just chatted in. So let me see what they said. Yeah, he is awesome, Mary. I like him a lot. Him and I teach very similar. So you're going to hear a lot of the kind of the same things that I taught y'all in training. Please let me know if you cannot hear what he's saying. If you can't hear it, just do in the chat that you can't hear. So I'm going to hit.
I recently posted a video on how to do a brow lift, and many of you asked questions on how I was able to inject underneath the eyebrow and not cause an eyelid-ptosis. Now, unpacking this is a very interesting way of understanding the anatomy, because, of course, we are all very afraid of causing eyelid-ptosis. Now, many years ago, when I first started training, I remember training an ophthalmologist who told me that they injected the eyelid close to where I was just warning my trainees to be careful of injecting. And they used 4 units, so 4 times more than I would normally use, and he'd never had an eyelid-ptosis. And this really got me thinking much more about the anatomy. So by the end of the show, if you watch it all, you should understand the nuances of different muscles and how they are differently affected to what you may have first thought when you first learned how to inject Botox in this area. So many people were concerned that my injection points were so close to the eyelid that I may cause an eyelid drop. Now let's first consider what actually happens if you inject the eyelid. So people have purposefully injected the eyelid with toxin, and you'll be surprised to find out, if you didn't know this already, that what will actually happen is your eyelid will actually lift. And that is because the superficial muscles that are in the eyelid are actually the protractors of the eyelid. They are not the retractors. So the retractor muscle is the levator pulpebri muscle, which runs in the orbit, and this is what we are concerned about not injecting. Whereas the orbicularis oculi, which actually runs in the eyelid, if you inject that, actually allows your eyelid to open slightly, because when you close your eyes, it's contracting, you relax it, it actually opens. So it's actually the reverse of what many people think, because they haven't thought about where the muscle that lifts the eyelid actually lives, which is in your orbit. So understanding this is the first thing around why you don't need to worry too much around eyelid-ptosis. But there are other elements too, because of course we can get eyelid-ptosis from injecting superior to the eye. So we need to think about what injections are likely to be causing that and what we can do to avoid it, and why my style of injection in my career has never caused an eyelid-ptosis in any of my patients. So that's part 1 of what to understand. We need to think about which muscles are likely to be involved and what injecting toxin actually does to them. If you're injecting superficially and you inject orbicularis oculi, you will find the eyelids actually more likely to lift. In fact, it's now a treatment for eyelid-ptosis when you've injected the other muscle, the levator pulpebri muscle. Knowing precisely where these muscles are and what layer they're in will give you confidence to inject in areas where other less thought out clinicians will think you're going to get an eyelid-ptosis. So let's think about the layers in this area. Obviously at the top you have the dermis, then you have a thin layer of fat in the hypodermis, and then you have the orbicularis oculi muscle. Underneath that, there's the retroorbicularis oculi fat pad. Then you have the orbital septum, and underneath that you have the preseptal fat pads, and underneath that you have the levator pulpary muscle. So there are actually multiple layers. So to help you understand this, let's think about the face and the anatomy in this area, not with all the difficult medical terms, but just as a sandwich. Imagine that you're having a sandwich on your mum's favorite tablecloth. That represents the most precious part of the anatomy, the orbit. We don't want to get ketchup on the precious tablecloth. And of course, if you make your sandwich directly on the tablecloth, you're going to make a huge mess and cause your mum a lot of upset. Or your dad. Might be dad's favorite tablecloth too. But what we actually do in real life is you have layers that protect that tablecloth. We have a placemat on top of that.
How many hours do you work out to look like that?
I don't work out.
Yeah, so how often do you meet with a dietitian?
Never. I don't go to the doctor.
You could think of the placemat as the preseptal fat pads. And on top of that, you have the plate, which you can think of as the orbital membrane. On top of that, you have your first layer of bread, which is the retroorbicularis oculi fat pad. On top of that, you may have the meat, the muscle. On top of that is where we try and put our ketchup. And one layer on top of that is the dermis. So actually, the ketchup is shielded from the tablecloth by multiple different layers. And it's exactly like that with injecting botulinum toxin. We're actually injecting tiny amounts just on top of the muscle, and we have multiple other layers shielding those important structures in the orbit. And it's the depth of injection rather than the position relative to the eyelid that keeps those internal structures safe. Another question that we got many times was, how many units do I like to place in the dots underneath the eyebrow? I find it really helpful using just a 1 unit dose, and this is enough to get a difference. I'm not necessarily trying to paralyze the bulk of the muscle. I just want to affect those fibers that are pulling the eyebrow down. This is also a safer amount. It's a bit like, to go back to our analogy, like using less ketchup. You're just less likely to get an inadvertent mess. So small amounts, wherever you can use them, are always safer. As a general rule of thumb, the dose response curve is less likely to cause you a problem. So that's why I use 1 unit. I typically use 1 to 3 units underneath the brow, and then I'll use my stronger doses where the licensed dose is higher at the lateral canthus. In terms of dilution, I usually use the standard dilution of 2.5 mils in 100 units of botulinum toxin, but sometimes I'll use a more concentrated form if I'm in an area where I just want to make sure there's less chance of a spread. But I used to do that a lot more than I do these days. I've had so few complications that I very rarely use different doses. When I do use the more concentrated version, it's in the lower face. Injecting the depressor angularis oris or the mentalis, I feel safer using a more concentrated dose. For most of the rest of the face, I dilute 100 units with 2.5 mils of bacteriostatic saline. Another question we got was, does the brow lift occur from injecting below the eyebrow or also from injecting above the eyebrow? And in fact, years ago, I had patients who would come and say, no, I've had an eyebrow lift, the doctor injected here, you have to do the same in order to get a lift. Now, if you think about the anatomy, this cannot be true because these are the elevators. And if you inject the elevator of the eyebrow, you're going to decrease the power of that muscle to lift. So you're actually more likely to get a drop. And in fact, most of us are very afraid of injecting directly above the eyebrow in the frontalis muscle because that is where you lose the eyebrow arch. So you only get a lift when you affect the little tug of war that's going on with the eyebrow between the two muscles. One's an elevator, one's a depressor. So if we weaken the depressor, which is the orbicularis oculi muscle, and you can see this because if you want to lower your eyebrow, shut your eyes very tightly and you will see your eyebrow comes down, and that's caused by orbicularis oculi. And the frontalis muscle does the opposite. So the tug of war is won by reducing the strength of the depressor, which is orbicularis oculi, not by treating the frontalis muscle above it. However, the other way we create eyebrow lifts is by increasing the resting tone of the lateral frontalis muscle. And this is done when we treat the middle of the frontalis and the lateral gets more active. So in some of my videos, you'll see that I draw cat ears, we call them, and I tell injectors generally not to inject in those cat ears. Now, those cat ears represent the elevating part of the frontalis muscle. So it's When I say that it reduces the chance of a ptosis, I'm talking about a brow ptosis, not an eyelid ptosis. And this is one of the biggest confusions that happens earlier on for people, is differentiating between a drop in the eyebrow and a drop in the eyelid. And nearly all of the cases I get sent are actually drops in the eyebrow, not in the eyelid. The actual eyelid is stable, but it's rested on by a heavy eyebrow. Typically, if they have extra fat above their eyes and that's resting, or they have an eyelid shape that just naturally transmits energy into the eyelid, it confuses injectors. But that is all to do with reducing the strength of the frontalis muscle in this crucial area that elevates your eyebrow laterally. So the more botulinum toxin that you place in this area, the more likely you're going to have that problem. And so particularly in females and not so much in males, I don't treat that area because I want there to be an eyebrow arch. Females also tend to use their eyebrows in a different way to men, which is to do with applying makeup. Every morning, if you apply makeup, you tend to lift your eyebrows up, whereas men do not notice the loss of movement laterally. So you can actually treat men quite often with more Botox in the cat ear and weaken the frontalis muscle all the way across, and it does not cause any problem or concern at all, whereas a female will miss that ability to raise their eyebrows and apply makeup. Other injectors were concerned by not treating the cat ear area that you may then cause a Spock brow. And in fact, this could be part of a Spock brow. Typically, I think of a Spock brow as a medial brow ptosis and a lateral brow lift. So if you overtreat the middle and undertreat the side, then absolutely you get this disequilibrium, and you have too much activity and too much heaviness in the middle, and that creates this unpleasant shape. So it is possible that you could be on that spectrum. Like everything we do, you're trying to make the adjustments to get a happy medium. So I want a little bit of a brow lift, not a huge one, and I adjust that sometimes by putting one unit in the top of that triangle of the cat ear, and that's typically what I'll do when I know the patient or when I'm confident that they have quite a strong frontalis. I will treat within the cat ear area. I think sometimes people see these markings and they think it's a definite no-go area. It's actually not. It's just an area that I'm more cautious of injecting, and it's helpful if you know you're creating an eyebrow lift, and if you don't know the patient, to start with leaving it undertreated and then to treat them at a follow-up and then make a note of where that treatment was. So then you have a plan that will work each time you see them. But the first time you treat someone, particularly if they're a little bit older and brow drops a little bit more likely, it just makes sense to see what happens with those units, get the result back in 2 weeks, and then make an adjustment, learn from it, and then you can repeat safely whatever you learn from that patient in the first course of treatment. So I hope that's helped you understand in more detail the three important muscles, particularly with respect to eyelid drops. So we've got the levator pulpary muscle, the orbicularis oculi muscle, and the frontalis muscle. And if you take away anything from this, it's the three-dimensional injection depth that matters most in terms of safe injecting around the eye.
All right, guys, clicked on the wrong thing. Give me 1 second. Okay, so we just went over the eyebrow lift and how you do it. So whenever I do an eyebrow lift, sometimes if I know a patient is automatically going to get heavy, like they are naturally hooded, I will go ahead and do an eyebrow lift while I'm doing the treatment. That way I can just prevent any type of heaviness. So I'll do the kind of standard, 4 to 7 injection points, depending on the patient's anatomy. And if they are naturally hooded, I will go ahead and just pop in an eyebrow lift at the time of injection versus having to go back 2 weeks later and then do a lift in case they get heavy. And this is something just kind of as you progress through your injecting career and through your your learning of the type of injector that you want to be, that you can start to kind of tailor your treatments to your patients. So whenever we're in training, I kind of give you a basic kind of foundation or a stencil on how you do basic neurotoxin. The more and more you inject, you're going to see how you kind of have to cater it to each patient. And that just comes with experience. Just like when you are learning to start an IV or you're learning how to do any type of new procedure, you're going to kind of find your own flair and say, okay, this is kind of how I learned it. And now I'm going to kind of start to learn how to cater it to each individual patient. So this is kind of how it is. 1 second. Bella or Athena, leave her alone. Sorry, they're trying to mess with my pig. All right. So the next thing that we're going to go over today is we are going to go over microneedling. So 1 second, let me click on this.
Most people have no clue that in 2023, the best way to make money on Amazon is not with physical product.
Okay, so
What is microneedling with the MD needle pen? Microneedling, also known as collagen induction therapy, stimulates the body's natural.
Okay, sorry, I'm gonna hit pause real fast. So we're going to talk about microneedling. We went over it in training, but this is specific training for the MD needle pen, and it's kind of going over basic what is microneedling, kind of how you use the pen. So this is just kind of a quick recap of everything that we went over in training.
Natural healing process by creating microchannels on the surface of the skin. This procedure leaves the top layer of the skin intact, allowing for shorter healing time and the ability to treat many different skin concerns. Each microchannel allows for the absorption of serums, hyaluronic acid, and PRP when used during the treatment. The body is stimulated to fill these microchannels by producing collagen and elastin, resulting in smoother, firmer, and rejuvenated skin. The motorized technology of the MD needle pen has the ability to adjust the sterile needles to depths ranging from 0.25 to 2.5 millimeters. These variable depths allow for the treatment of deep wrinkles and acne scars, in addition to delicate areas around the lips and eyes. Microneedling is an effective treatment for many skin concerns, as we can see by analyzing these real-life before and after photos. Before treatment, observe that the acne scars are very deep and pigmented, but after microneedling, the skin is smoother and pigment is diminished. Notice the pronounced smoker's lines here before microneedling. After treatment, the lip lines and wrinkles are minimalized. Here, we see increased skin laxity and rough texture before treatment. Once microneedled, the skin is tighter, firmer, and smoother. See the sun damage and uneven tone in this patient's skin before treatment? After microneedling, pigment is lightened and the skin tone is more even. Notice the brown spots, wrinkles, and skin texture before treatment. After microneedle therapy, aging skin is less crepey with reduced dark spots. Before treatment, we see stretch marks that are very dark and highly visible. After needling, they are smoother and the color is less prominent. Before treatment, there is a noticeable shortage of hairs on the scalp. After skin needling, the number of hair follicles is dramatically increased. Clinical studies have shown microneedling as a safe and effective alternative to ablative laser treatments. With no thermal injury to the skin, a short healing time, and the ability to treat any skin type, it is a skin transformative procedure for every person. Clinical specialists designed the MD needle pen with durable stainless steel outer shell for reliability and gave it the ability to be used corded or cordless for flexibility. The surgical-grade stainless steel needles are individually sterilized for patient safety and comfort. MD Needle Pen is committed to patient results and has developed unique advanced protocols from actual in-office procedures. To learn even more, we have a clinical study underway with Shriners Hospital for Children for the treatment of hypertrophic burn scars. Microneedling is a safe and effective skin rejuvenating procedure that uses the body's natural cellular regeneration to stimulate collagen production. If you are interested in this unique anti-aging treatment that tightens, lifts, and smooths the skin, visit us at mdneedlepen.com or contact one of our local practitioners.
All right. So that was kind of going over the basic of the MD needle pen, and that is a specific pen that we use here at MFL. The big thing with microneedling is at the age of 35, your body stops producing its own natural collagen. And so what you want to do with your patients is you want to do a lot of education because, patients, they come in and they want to get rid of those kind of deep resting stasis, the wrinkles that they kind of have like in their forehead. And then as you start to kind of treat them, you really need to educate them on treating the entire patient. So we're not just doing neurotoxin. We're not just doing filler. Talk to them about doing chemical peels, about adding microneedling, because you really want to make sure that you are taking care of the skin and the health of the skin. It's also a good time to talk to your patient that make sure that they're using a good skincare and obviously sunscreen as well. So Education is going to be really important in the aesthetic world. They're not, don't just be the injector that, hey, I'm just putting, the super invasive neurotoxin and fillers. Talk to them about all the other services that we offer, and then also just kind of good hygiene, drinking water, kind of getting good sleep, all of those kind of things, because we're taking care of the whole patient. Any questions at all on microneedling? Perfect. All right, moving on.
Quick question, sorry.
Yep.
So they mentioned something about in the hair, for hair growth. Is
Yep.
that something that I've never heard of that?
Yeah, so a lot of people will do a PRP. You can also use our serum as well for hair growth, and just kind of help stimulate that hair follicle growth again. The only issue with PRP, we actually don't offer it because you have to have a centrifuge and you have to do a venous puncture and all those kind of things, and that's difficult when you're concierge. But and also whenever you're doing PRP, if the patient has quote unquote bad blood, or like they're a smoker, they're morbidly obese, or they have high cholesterol, if you're not getting a good product that you're pulling for that venous puncture and you put it back in, it's really not going to do a whole lot. So that's where we have kind of elected to do the different serums that we offer. And the two serums that we carry is we have the Glow, and that's our basic one. And that is pure HA, vitamin C, and vitamin B12. And then the Liquid Gold are those three ingredients plus Sculptra and neurotoxin as well. So that it really does do a lot as far as hair growth, skin rejuvenation, helping with fine lines and wrinkles, skin texture, even kind of like different discolorations on the skin. So I like microneedling a lot. I usually tell my patients to get it once.
Oops, sorry. Yeah, no, I'm really surprised to see that, and I appreciate you guys going over that, because I think that's something that we'd be interested in offering.
Yep, absolutely. Okay, so let's go over the difference between an enhancement versus a finesse. So whenever a patient comes in and you treat them today, and then they tell you the next day, my Botox or Jeuveau or Dysport has not kicked in yet, you are going to obviously tell them that they need to wait the 14 days. So you cannot do anything prior to 14 days because that neurotoxin has to totally kick in. After the 14 days, let's pretend that they have like a little bit of a Spock eye or a brow ptosis. Then that is something that would be considered a finesse treatment. I need to go in. I might need to add just a little bit more. I need to maybe lift an eyebrow or drop an eyebrow. That is a finesse, and that is completely covered. The patient does not have to pay for that. However, you do have to drop the pen for the, it's $12.50 for the appointment fee, but it gets zeroed out at the end. So please just know that, but you still have to drop that pin. Otherwise it messes with payroll. So please always, always, always drop the appointment fee pen. But if it's a finesse, then you have to do the $12.50. So it'll zero out for the patient. If the patient just wants more, like, oh, they wanted to go kind of light whenever you were treating their frontalis because they were kind of nervous. And then they called you 2 weeks later and you said, or they told you, hey, I think I just need more because I'm still having some movement, that would be considered an enhancement. And that's just because the patient, they might have been on a budget, it might have been their first time and you went kind of light, but that's where it's really important that you document all of that in your chart. So you can say, okay, at my treatment, I discussed the patient of full dosing and they elected to do half dosing, either based off of budget or just because they were nervous about it. Please make sure you document that, because that will help protect you if the patient comes back and says, hey, I think I just need more. For a finesse treatment, it's a total of 4 units of Botox or 10 units of Dysport. So that would be able to get you a bilateral lid ptosis or bilateral Spock eye, or if you just need to add just a little bit more right at the hairline, something like that, that will totally be covered under finesse. But if anything over that, that's considered an enhancement. The last one on here is a failed toxin. And this does happen. Typically it happens because the bottle got hot, usually from the manufacturer. And if this happens, please let us know. We will reach out to the manufacturer and then they will reimburse us and give us a brand new bottle so the patient can be treated at no cost. In order to do a failed toxin, you do have to have administrative approval, and we will ask for before and after pictures. We'll make sure we look at dosing, all of those kind of things to determine if it's true a failed toxin. We had one actually a couple of weeks ago, and like the neurotoxin just did not work at all. And the injector had treated 2 patients with the exact same bottle. They reconstituted that day and nothing worked. So it was just a bad bottle. It does happen. We called Allergan and they gave us a new bottle, and both patients were retreated. So just know that's the difference. Any questions on enhancement, finesse, or failed toxin?
I have a question. So if you do the Botox during your launch party
Mhm.
and they need additional doses 2 weeks later, do they still get the launch party prices?
No.
Okay.
Yeah, they would not at that point. Yeah, correct. Great question. I mean, so if you're at their launch party, I would recommend that you do full dosing on them and you're not, being concerned like, oh, hey, I'm just going to go light. I mean, it's not going to be significant, right? I mean, you're probably talking, $15-20 at that point, depending on, how light you're going. So it's not significant enough to say, they're not going to save that much money versus just going ahead and doing the full dosing on them. And really, I would be very cautious about kind of doing half dosing on patients. In my experience, they typically do not end up happy because in their head, they think that they're going to be frozen. And so when you do half dosing or lighter dosing, they are still going to have movement and they're going to end up calling you. So that's totally fine. If they do just want to do half dosing, please just document it in your chart. That way, that when the patient comes back to you, you can say, hey, we talked about this. You're just going to have to pay for the additional units. So just know that. Any other questions? Barbie, stop. Sorry. Okay, moving on. All right, so this week for our marketing homework, if you followed up with, if you called salons last week, at this point we're gonna have you follow up with them, and then for marketing for social media this week, you're gonna post 2 times. The first one is gonna be a before and after of an eyebrow lift. I have that graphic for you, and it says it's under $50, so it's kind of like a flat rate pricing, and that's typically when you use Juvo. You can also get it even cheaper, or if you're using Dysport is actually doing $50 off for brand new patients, which is great. So the patient can save even more money off of that, and you will get paid off of the full amount with that. So just know that. And then the last thing that you're going to be posting, it's an education post about the benefits of microneedling, and this is something that you will make up on your own. So I will supply you with the eyebrow lift graphic. It will be on the Facebook page, on the onboarding group. It'll kind of either be in the comment section or in the actual post. You can just copy and paste it or screenshot it and post it to your own social media page. And then the second thing is going to be your education post that you will make up about the benefits of microneedling. And I had talked about last week about starting following additional people. I've added 2 more people that I would like for y'all to follow. Again, I want y'all to be a sponge, learn from everyone. These are 2 really kind of great people to follow as well. Also, they give great kind of marketing advice. So you can see how different injectors market themselves to kind of give you additional ideas of kind of what you want to do in your own kind of marketing practices. And that's going to be the Ninja Injector and then the Aesthetic Injector, Tawny. So both of them are really good. They do a lot of different education. You can look at the aesthetics of their social media pages and just kind of how they do everything. So again, be a sponge. All right, well, that is it for this week. Does anyone have any questions?
I do.
Yeah.
So because I'm in Virginia and I'm catching up.
Yep.
So I'm trying to figure out where should I start. I did the week 1.
Okay.
You got 2 and 3 with. So should I jump in with this
Nope. Start with
marketing
week 1.
strategy?
Yes.
Okay.
Yeah, definitely start with week 1. Yeah. So definitely follow the progression. So,
Okay.
we wanted you to hop on these calls just so you're not behind on all kind of the other things that we do, and we want you to kind of get you caught up and just kind of into this with this group. But definitely start with week 1. Watch the video. I think week 1 is probably the longest. I think that one is maybe an hour long. All the other ones, I usually try to keep them around 30 minutes or so. That's kind of my goal. I think last week was actually the shortest one. I think we were at like 18 minutes or something like that. So, follow it. You don't have to go the whole week and wait. You can actually, watch as many videos as you want. If you wanted to watch all of them in one day, you absolutely can. But I just kind of go over homework and how you do everything. And the homework is really to help you. It's not that while these calls are mandatory that you go through, the homework is meant to kind of help you know where to start because nurses, especially nurses and all healthcare individuals, we're not great about marketing ourselves. And so I just kind of give you additional ideas. And for our brand new injectors who have, never taken a training before, it's a lot to learn within 1 to 2 days. And so this kind of helps break things down even more. And so we really can kind of cement this information into your head. So that's really the purpose of this. But yes, definitely start at week 1 and then you can go through all that. But I definitely recommend watching all of the videos prior to next week. That way you can kind of catch up and you know exactly where everything is.
Okay, thank you.
Yep. Any other questions? Perfect. All right. Well, we are done. I will post this video and the homework tomorrow. And please make sure you fill out the Google form, and I will see everyone next week. Bye, guys.
Thank you. Bye.